Wow, it was very difficult one. Looking much better. Please sit down. Okay, we'll not make him cry. The lip is very nice. So this is now how many months after the surgery?
This is for 3.5 months completed.
3.5 months only. Wow, that's good. Okay, baby. So this cutie has come for palate repair now. That's how he came to us first. We've done a bilateral repair. This was a pretty challenging one. As you can see, the prolabium was really twisted, asymmetrical, and all of that has been sorted out. And he's got a tooth also,
Yes.
which is a good thing, okay? When the child gets tooth from here, it's a good thing because the vascularity of the prolabium segment is good.
Okay.
And the natural process of the tooth eruption is happening, which is very, very good.
Okay.
Not all kids get it, especially when you have a wide prolabium. Your child has got, so it's very good sign because you can expect 4 teeth to come there.
Okay.
And then when we do the palate inside and when we do the bone grafting, full set of teeth will come.
Okay.
So it's a good thing.
Now
And it's
we
happened
will
very
do the
well.
bone grafting now itself.
No,
Later.
all later. Bone grafting is later. I'm just telling you it will happen because, I mean, generally, like it takes a little longer for the tooth to erupt. It's just 3.5 months you're saying, and 3.5 months he had no teeth, and now there's a tooth. That's a good thing.
It is
Okay.
done on September 10th.
September 10th,
Yes.
so we have October, November, December, Jan. Almost 4 months now.
Yes.
Okay, we'll quickly see his palate now. He might cry a little bit. Hello.
Yes, Bin.
1 second, Baba. So we're going to show you the palate. It's a pretty wide one again, like the lip. Okay, oh, you know this is the one. I don't like it.
Please touch his hand.
Ayyo.
Just a little. Okay, there you go. So that's a palate. I hope you can see that. Okay, fine. விட்டுருங்க. அவ்வளோ வைக்காதீங்க. IV line போட்டுருங்க இப்போமே. So we're planning surgery for him later today around 4 p.m. Yes. So it's going to be similar to last surgery. Only thing, this is a little bit more major surgery than last time, not minor. I'm not telling this to scare you, but just to tell you that the similar recovery period, everything will be there. Today he'll be in the ICU. Yes. And tomorrow he should be fine.
Sir, what about the voice?
Voice should be good, right? Lot of the kids that we operate speak very well without any intervention whatsoever. So don't worry.
He's speaking somewhat 2 words, sir. Up to 3 words.
No,
Mama,
but
Papa.
now he's a baby.
That's
We have to
right.
fix the palate so he speaks well as he grows.
Somewhat clarity only.
Should be there, don't worry about it, should be there. See, your child has got a very severe form of clefting. I mentioned last time itself. So still the result is good. So we'll hope and pray his speech is good. A lot of our patients, even with a very severe wide bilateral, speak quite clearly. So you don't have to be worried about anything. Okay?
Okay.
Painer.
Will you remove this teeth?
Which teeth?
This which is
No, we won't remove any teeth. You should not remove any teeth.
already one tooth. What happened is sitting there.
This
He
side,
fell down?
sir. This side, sir.
I can see it has gone in little
Yeah,
bit.
Actually, previously he has one more tooth. I will show you that tooth.
Don't worry, even if it is bent, we won't remove any tooth because this is only the primary teeth. The deciduous teeth will be there only for few more years. When he's 6.5, it will fall away and permanent teeth will come.
This in middle teeth it
No
is
remove.
coming twist.
No problem. Even if it is coming twisted, don't do anything.
Under one doubt, sir.
Hmm.
Actually, after now you will do palate surgery.
Yeah.
It will go somewhat inside, sir. It's-
No. Automatically it will go inside, not because of the palate surgery. Ah, yeah. So he has fallen down and made it bent.
No.
It's okay, nothing to worry. No problem, don't worry about that tooth now.
This is what it came very outside.
Outside
we are
and then-
asking why we should do. We are asking to. We are requesting why he if he dislike he will do means he only suffers, so that we are asking.
Nothing to do about the tooth, but we shouldn't remove that tooth, we shouldn't touch the tooth. because that tooth is required for the permanent tooth germs to germinate in the future. I'm telling you, it's a good thing that the teeth has come,
Yes.
not a bad thing. So don't worry.
And one more thing, will it be go somewhat inside or it will be safe?
As he grows, it will go little bit inside. So the lip will be very nice. The nose will not be very nice, will just be average because of the fact we haven't done a full open rhinoplasty. But after he grows, it will not look too bad, don't worry. We can do some procedure once he finishes growth. No need to intervene now. Yeah, finally, yeah. Surely we can do that. So by the time there will be no cleft stigma left. Alright? Done. I'll send you over to the nurse in charge so she can put the IV line. Because we're going to start surgery in the evening, and if we fast, then it's difficult to get IV line. Alright?
Sir, one last doctor. Again, I am asking the same doctor. This is.
That will go inside.
After surgery, little bit it will go inside. I am asking.
No, after palate surgery, no connection. But automatically after the lip surgery, it is going in. It will continue to go in.
Okay.
Yes. Don't worry about that.
After the lip goes, it will push.
It will push it inside and get better and better.
It will be like normal like us or it will
Well, I would not say exactly like someone who doesn't have a cleft, but as close to that as possible. But one thing I can definitely say, after he grows up, once he gets the mustache, once we get a proper nose, a proper speech, and somebody cannot quickly distinguish that he was a cleft kid. That is for sure.
But it takes some time.
It will take some time. Even now, he cannot see clearly. I know, but for the deformity he had, this is like much better, right? So don't worry.
what about the amount?
Bilateral cleft palate. This is him with us about few months back. Yes, this was about when he was almost 6 months old, and right now the baby has turned just 10 months and he's scheduled for a primary palatoplasty. It's a wide bilateral one, so it's going to be a time taking one for Dr. Richardson. And yes, he does have a family history of cleft in his family. The parents had come all the way from another state for a surgery months back, and this time again they've come for a palate repair. We'll see how it goes. He has a cleft lip, alveolus and a palate. Lip being done here previously, a wide bilateral one as we can see with the prolabium sticking out. This time it will be a primary palatoplasty for him.
Yeah, and you hold your hands. Yeah. See the full palate. Okay, uvula. Everything is fine. Can you see? Okay. Good. So you have to take further care for at least 3 or 4 more weeks. So that the whole sutures are healing and everything is fine. And don't give any hard diet, normal liquid diet, stuff like that. And you will not have to come again now. Maybe after a few years you can come. And daily, just take care. It's healing well now. And we can see after maybe 3-4 years or 5-6 years maybe. No hurry. Only when he's 7 to 8 years we have to do the bone grafting. When he's about 4 years we have to do the speech assessment. Nothing to do before that. He'll speak well, nothing to worry. Initially take care. He should not put his hand inside, not put anything sharp or anything hard, or make sure that nothing happens. Bleeding should not be there. And that's it. Teeth may not come in the proper order, don't bother about it. Just ignore that because these are deciduous teeth. Okay? You're going tomorrow or today? Today. Alright. So safe journey. And you can send us follow-up on the number.
So sometimes if anything serious is happening.
Yeah, nothing serious will happen. For any regular consultation you can contact us.
Regarding the teeth also we are very much worried.
Now you don't be worried. I told you no. But in case anything is there, you can contact us. We will reply surely. The doctor is on that phone. So we will be able to reply you.
Speech.
Not required mostly, we'll see. 3.5-4 is nothing really.
He can speak.
Of course. Surely.
Sir, one photo.
We'll take a photo. With the baby. Okay, there's your phone. Yes.
So much of difference.
So,
I know. He looks
actually, you
cute right
said
now.
first words. Now I am remembering that you will not even guess first thing.
Yeah, it was quite difficult for him. I do remember that. Yeah. His palate also was white.
Yeah.
You know, it's come out well again. Take good care initial few days. Yeah, let's take. You can take a selfie, no? The moment take a selfie. Yeah.
Just been.
Please. He's not very All right. So you people are going to Hyderabad, right? Okay. Right. Safe journey. And then.
Just been.
Look there, Baba. But it's good he's not having pain, you know. If you look at his face, he's like quite comfortable. Hello. Yeah.
Thank you.
All right. Bye bye.